the healthcare industry transformed over the past 40 years?
Big changes, multiple levels. Way back in the 80s, India saw lots of epidemics, and these were mostly infective diseases, infectious diseases, gastroenteritis, hepatitis, malaria. You'd see a lot of that. And whereas today, the epidemic is of lifestyle disorders, obesity. You talk about hypertension, diabetes, osteoporosis. These are the kind of diseases which are actually afflicting the Indian population. Back then, the focus was on cure. Today, the focus is on prevention. So these are two very, very large changes which happened. But I would say, down the middle, the biggest shift that actually hit the healthcare industry was the internet. When Google suddenly entered the relationship between patient and doctor. Earlier, the doctor would write you a prescription and you just shut up and you bought that prescription. Today, when a doctor writes a prescription, a lot of guys come out and the first thing they do is Google the drugs. And they don't even Google what the effect of that drug is. They're actually Googling what the side effects of the drug are. So in many ways, Google can be helpful and it can also make you into a quack doctor, which is not good. So this huge intrusion has happened, where people are actually cross-checking what they're taking, what is being recommended to them. Going forward, as AI enters the fray, that's going to add a completely different dimension to this already very complex situation. That would be the downside. The upside is that looking at the way healthcare is progressing, with the internet coming in and AI coming in, a lot of people in remote areas are going to have access to very good consultation by very good doctors. So it's totally transformed. To the focus on prevention is one of the biggest changes. Fitness is very, very big. Fitness is possibly one of the most important things today if you look at the amount of gyms that have opened all over the place. Earlier, way back in the day, I hate to say this, it makes one sound very ancient, but it was okay to take 6 days off. I've got malaria, I'm in bed for 6 days. Today you'd see a mother talking to a doctor and saying that, he can't afford to miss school. And then you're wondering, is he in his board exam or is he doing his PhD? And she says, no, he's just in the second standard, So even getting your child off duty, getting him out of school for 2 or 3 days is causing, huge upheavals. People cannot afford to fall ill. People do not want to fall ill. Also, what's happening is that healthcare and medicine has become very expensive. So cure costs, although the quality of healthcare is fabulous, it's much more expensive. It's a lot more economical to stay healthy and not to fall ill. So these huge tectonic shifts are taking place in healthcare. Cure to prevention, the internet, AI coming in, and the biggest being the focus on fitness.